Welcome back. So we look at this story now. A report by Bhekisisa has found thousands of newborn babies are dumped every year in South Africa. Research shows that this is caused by a lack of options and stigma around safe abortion. But we get reaction and certainly the why to this. We are joined by Femicare endoscopic surgeon, Dr Thato Maoto, who joins us this evening. Dr Maoto, thank you so much for your time. We really do appreciate it. And I will get into the numbers in just a moment, but this is a really interesting problem that we're facing, concerning in the sense that abortion is very much legal in South Africa, and yet we have a scourge of finding fetuses in velds and dump site. Why do you think this is the case?
Yeah, thanks for having me, and good evening to your viewers. I think it's a multifactorial causality of the scourge of increased abandonment. I mean, it's clear to us that it's actually against the law to abandon children, and especially fetuses. But what we have to look at is, if you look at what causes it, you'd have to look at access to things like education, counseling, support services for our pregnant mothers, and more importantly, the sometimes lack of access to safe and effective contraception. Because the important thing, I think, in all of this is prevention of this whole scourge. And it can be quite complicated because it involves, I think, different facets of society. I mean, Department of Health, Department of Education, social development. So I think it's quite a big problem, but it has many causes and complicated.
And I just want to look at the numbers. According to Bhekisisa, experts estimate that abandoned babies and fetuses make up 2% of the 70,000 unnatural deaths that are recorded in South Africa of unborn babies. And so if 2% of 70%, I had to do the maths, that would bring us to about 1,400. I mean, 1,400 dumped babies every year is a very big number. Is the issue that in some communities there simply is not the greatest access to facilities, and yet somehow access to unreliable procedures and fake pills? And perhaps you can speak to us about the proliferation of some of these fake abortion pills that are in our communities.
Yeah, that's a big problem that we're still having in South Africa. So the pills, unfortunately, are not fake. What is fake is the healthcare professionals providing the pills. So there are some unscrupulous characters that get hold of abortive pills and give it to young girls. So it's what we would term unsafe abortion. And the reason we call it unsafe or unsafe termination of pregnancy is because in these instances, usually what happens is the young girls or the patients are given the pills but are not actually monitored and end up bleeding quite a lot. And in most instances, the bleeding can actually be quite life-threatening. So that's very, very unfortunate. But yes, I think you've touched it. You've hit the nail on the head in that we definitely have a problem with access to safe termination of pregnancy facilities. Remember that the Department of Health and the government actually provides health centers that actually cater for safe abortion. And I mean, you can go and have a safe abortion before 12 weeks, no questions asked. And in certain instances, between 12 and 20 weeks with a good reason. But yeah, sometimes the access is what's lacking in most of these instances, definitely.
I think about where you might very well have the access, so the facility in your community where you can go and access the service, but the reality of a 17-year-old girl walking into a facility in some of our communities and requesting one, a frightening thought for many of them.
Yeah, definitely. I mean, you can So the issue of access can be quite controversial, because remember that in South Africa, any girls above the age of 12 actually have access to their reproductive rights. So sometimes, I mean, the 17-year-old is quite scary, but imagine a 13-year-old going to a health facility with a sister, how unnerving and nerve-wracking that should be. So sometimes, I mean, there are things that limit those access. And in certain instances, us from our side, the healthcare professionals that actually limit that. But in a lot of instances, you can imagine that if we say that the cutoff for the no questions asked termination is 12 weeks, if you come and we have a list, we say, okay, there's 20 patients for the day, and you're patient number 80, you can imagine that sometimes that gestational age gets pushed past 12 weeks, and that can be quite nerve-wracking. And sometimes it's about just education. I think a lot of young girls don't know that these facilities are actually available and free.
That education, though, is not an easy thing to get right. Because quite often if you go into any sort of public platform and you talk about how a girl from 12 years old and above can walk into a health facility and request an abortion, that is not really a conversation that South Africans necessarily want to have and listen to. And so, I mean, there's something to be said about the messaging that we need to get right, how you get the education out. I mean, do we go into basic education? Do we go into, you know, community radio stations? What needs to be done so that we're not seeing officials picking up fetuses in felt?
Definitely. I think I mean, it's all of the above. In that, I think we as a society must accept that girls as young as 10 years old, 9, 10 years old, are having unprotected sex. And we know that the age of sexual debut in South Africa has been slowly decreasing over the years. So more and more young girls are having sex. And I'm sorry to speak only of the girls, but also obviously the boys are involved. But we must remember that the reproductive burden is actually higher for the girls, because they carry the child for 9 months, and they have to deal with the consequences more so than sometimes the boys. But yeah, I think all of the above. I think we need, it must be all of us. We must be on TikTok, we must be on social media. Programs like this will help. And we must make this information accessible. And I think we must remove the stigma that, girls as young as 12 years shouldn't be having sex, because they are. And we need to deal with that.
You've got this report by Bhekisisa, and I want to read just one line from it, saying autopsies revealed that most fetuses found abandoned are not developed enough to survive outside the womb. So, you know, there's, of course, the picture of what this girl or young woman would have been going through in I suppose, this process of termination. But also what this does to this young woman's body after the fact. Because if you're abandoning a baby, there's very little aftercare.
Yeah, that's actually the big worry. I mean, from a clinical point of view, if you're having an abortion at that stage, you do need aftercare. But also from a psychological point of view, just think of psychologically what happens if someone has an abortion alone in the veld and leaves the baby there. And the issue of viability, because that's what they're actually talking about there, is that a lot of these fetuses that are left are above the age of 12 but haven't reached viability, which means they can't survive without the mother. But they're quite big. You get them, below about 600. You can see there's a baby. You can see the sex of the baby. Some have breathing moments when they are born. So you can imagine the psychological impact apart from the clinical. And the clinical is also important. So I think the messaging should be that for anybody wanting an abortion, they should seek medical help as soon as possible. But more importantly, I think prevention, contraceptives, being made available is even more important.
Yeah. The issue Bhekisisa raising there, the importance of training healthcare workers to provide non-judgmental care something that could reduce unintended pregnancy. Dr. Maoto, thank you so much for your time. A difficult but certainly a critical conversation. Dr. Thato Maoto, the endoscopic surgeon at Femicare Fertility Center, speaking to us this evening.